Okay, so let's focus a little bit on, let's say, more edentulous cases then. Here's a question for you, Dr. Moy. In the full case where the ISQ values were low at insertion, do you think you would get better ISQ readings at 6 months with the submerged technique?
The answer is yes, absolutely. With the data that we have analyzed and just submitted for publication, it's very apparent that with low ISQ values, if you bury the implant, and whether you wait 4 months, 5 months, 6 months, the integration rate is close to 100%.
Yeah.
And so I would say yes, you would get definitely better ISQ readings after burying the implant.
You just try to avoid any pre-contact. I
Correct.
think that's it. Leave it alone.
Yeah, and in the case where you actually did load the patient, you said something about the most distal implants. Could you repeat that a little bit?
Yes. In the fully edentulous, where we have the benefit of cross-arch stabilization and basically tripoding, because you have implants in the posterior, you have implants in the anterior. I feel in those situations, if your patient wants to take that risk, you can immediately provisionalize because you are tying 6, 7, 8 implants together. Mm-hmm. And this is where I also disagree with Danny. Yes, I'm the clinician. Yes, I'm responsible for those implants. But we have to take the patient's desires into account. And so, you know, I understand that it's very different in America versus Europe. But if you practice in Los Angeles, I guarantee you, you can say, I'm Professor anyone, and these patients will look at you like, so?
I'm happy in Switzerland.
Big deal.
No,
So,
no.
you know, I came to you because I know from reputation what you can provide for patients.
Yeah, but we are talking about a full edentulous case. I would never question that. I said we are using that. If the patient benefits from immediate loading, no problem. I was talking about a single tooth, and that's a different story, because then the patient can eat, patient can smile, he can do everything, you see. Yeah. And then I argue with my patient, said, you see, we want to go for an, let's say, a predictable long-term result. Because in my experience, I mean, I treat a lot of patients, as you do, patients not coming and said, can you give me tomorrow a crown? He wants to have a good result that looks good and that stays there for a long time, because he pays a lot of money for that treatment. And that's the argument. That might be in the European side a little bit more conservative, but I think it's all a matter of discussion. And therefore, I also would be in the States in good business, I promise you. But I stay in Switzerland.
Okay.